Colon cancer is one of the most prevalent and deadly forms of cancer worldwide, yet many people remain unaware of the critical warning signs. Early detection is absolutely crucial, as it can dramatically improve treatment outcomes and chances of survival. In this video, we'll dive deep into 11 key symptoms that you should never ignore, as they could be indicators of this insidious disease. Colon cancer begins in the large intestine and, if left unchecked, can spread to other vital organs. With over 1.9 million new cases diagnosed globally each year, it's a growing public health concern that demands our attention. By learning to recognize the subtle signs, you can take proactive steps to safeguard your health and potentially save your life. So, let's explore these 11 critical symptoms in detail because your well-being is simply too important to overlook. What is colon cancer? Colon cancer is a type of cancer that originates in the large intestine, also known as the colon. It begins with the development of precancerous polyps, small, abnormal growths on the lining of the colon or rectum. Over time, these polyps can progress into cancerous tumors if left undetected and untreated. While colon cancer is more prevalent among older adults, especially those over the age of 50, it can also affect younger individuals. Early identification of polyps through regular screening is crucial, as it allows for timely intervention and prevention of the cancer from advancing. Understanding the basics of this disease is the first step towards taking proactive measures for your health. Number 1. Changes in bowel movements. One of the most common early warning signs of colon cancer is a noticeable change in your bowel movements. This can manifest in a few different ways. Some people may experience persistent diarrhea or loose, watery stools that don't seem to improve over time. Others may struggle with chronic constipation, where they have difficulty passing stool or feel like they're never able to fully empty their bowels. It's important to pay attention to any significant and prolonged alterations in your regular bowel patterns. If you find yourself running to the bathroom more often or straining to go, those could be red flags. Likewise, if you notice your stool has become thinner, ribbon-like, or has changed color, that warrants further investigation. While these symptoms don't necessarily mean you have cancer, they're signals that something may be amiss in your digestive system and should be evaluated by your healthcare provider. Don't hesitate to bring up any bowel changes, as they could provide critical clues about your colon health. Number 2. Blood in stool. Another potential warning sign of colon cancer is the presence of blood in your stool. This can manifest in a few different ways, and it's important to pay attention to the specifics. Bright red blood is often an indicator of bleeding lower in the digestive tract, potentially from the rectum or colon. This could be a sign of polyps, hemorrhoids, or other issues. On the other hand, dark red, maroon, or black-colored blood in the stool is more concerning, as it typically signifies bleeding higher up in the gastrointestinal system. This deeper, darker blood may come from tumors or other more advanced conditions. It's crucial not to dismiss any blood in the stool, regardless of the color, as it warrants a prompt medical evaluation. While the presence of blood doesn't automatically mean cancer, it's a symptom that should never be ignored. Bringing this to your doctor's attention allows them to investigate the root cause and determine the appropriate next steps for your health. Early detection is key when it comes to colon cancer, so be vigilant about any changes you observe. Number 3. Persistent abdominal discomfort. Another potential warning sign of colon cancer is persistent abdominal discomfort or pain. This can manifest in a variety of ways, such as chronic cramping, bloating, gas, or a general feeling of unease in your midsection. It's important to differentiate this type of ongoing discomfort from the occasional stomachache or indigestion that we all experience from time to time. With colon cancer, the abdominal pain or discomfort is often more severe, frequent, and disruptive to your daily life. you may find yourself dealing with it on a near constant basis, with little relief, rather than just experiencing the occasional bout of discomfort. The pain may also be localized to a specific area of your abdomen, which could indicate the location of a tumor or other issue within the colon. If you're dealing with consistent abdominal pain or a general feeling of unease that just won't go away, it's crucial to have it evaluated by your healthcare provider. While not all persistent discomfort is a sign of cancer, it's a symptom that warrants prompt medical attention. Early detection is key, so don't hesitate to speak up about any ongoing abdominal issues you're experiencing. Number 4, feeling of incomplete bowel emptying. Another concerning symptom that may indicate colon cancer is the persistent feeling of incomplete bowel emptying. This is a sensation where, even after using the restroom, you still feel like there's more that needs to come out. It can be an unsettling and disruptive experience that impacts your daily life. This incomplete emptying feeling can manifest in a few different ways. Some people describe it as a lingering pressure or a sense that their bowels haven't fully evacuated. Others may feel an urgent and persistent need to have a bowel movement, even shortly after just going. This can lead to frequent trips to the bathroom and a general feeling of discomfort or dissatisfaction. It's important to note that the occasional sense of incomplete emptying is not necessarily a cause for alarm. However, if this becomes a consistent, nagging issue that doesn't seem to resolve, it's worth bringing up with your healthcare provider. Persistent feelings of this nature may be a sign of an underlying condition, such as a blockage or tumor in the colon, and warrant further investigation. Number 5, weakness or fatigue. One symptom of colon cancer that often gets overlooked is persistent, unexplained fatigue or weakness. This goes beyond the normal tiredness we all feel from time to time. It's an overwhelming sense of exhaustion that doesn't seem to improve with rest or lifestyle changes. Individuals with colon cancer may find themselves feeling drained and lethargic on a regular basis, despite getting adequate sleep and maintaining their usual routine. This extreme fatigue can make even the simplest daily tasks feel like a significant effort. You might find yourself lacking the energy to participate in activities you once enjoyed, or needing to take frequent breaks throughout the day just to get by. While fatigue can have many potential causes, it's an important symptom to be aware of, especially when it's severe and doesn't seem to have a clear explanation. Unexplained, persistent weakness or tiredness could be a sign of underlying issues, such as anemia or the cancer itself causing an imbalance in your body. If you find yourself constantly struggling with fatigue, don't hesitate to bring it up with your doctor for further evaluation. Number 6, unexplained weight loss. Unexplained weight loss is another potential red flag when it comes to colon cancer. If you find yourself shedding pounds without making any deliberate changes to your diet or exercise routine, it's a symptom that deserves attention. Colon cancer can sometimes interfere with your body's ability to properly absorb nutrients, leading to unintentional weight loss. This may be accompanied by a poor appetite, nausea, or a general disinterest in food. Some individuals with colon cancer also experience unexplained muscle wasting, where they lose weight and muscle mass despite their best efforts to maintain a healthy lifestyle. It's important to note that weight changes alone do not automatically mean cancer is present. However, if you find yourself dropping a noticeable amount of weight without trying, say, 5% or more of your total body weight in a short period of time, it's worth mentioning to your healthcare provider. Sudden, unexplained weight loss can be a concerning symptom that warrants further investigation to determine the underlying cause. Number 7, anemia. Another potential symptom of colon cancer is anemia, a condition characterized by a deficiency in red blood cells or hemoglobin. Anemia can manifest in a variety of ways, but some of the most common signs include persistent fatigue, weakness, and a pale or sallow complexion. Colon cancer can sometimes cause slow, chronic bleeding within the digestive tract, which can deplete the body's iron stores and lead to anemia over time. This blood loss may not always be visible in the stool, making it an insidious symptom that can be easily overlooked. In addition to feeling constantly tired, individuals with anemia related to colon cancer may also experience dizziness, shortness of breath, and a rapid heartbeat, even with minimal exertion. They may notice their nails becoming brittle or their skin feeling unusually dry and cool to the touch. If you're experiencing these types of symptoms, it's important to bring them to your doctor's attention. Anemia can have many potential causes, but it's a sign that your body may be struggling with an underlying condition, including the possibility of colon cancer. Early detection is key, so don't hesitate to speak up. Number 8. Pencil-thin stools. One lesser-known, but potentially concerning symptom of colon cancer is the presence of pencil-thin or ribbon-like stools. This change in stool shape and size can be an important warning sign that warrants further investigation. Colon cancer can sometimes cause a partial blockage or narrowing of the intestines, leading to the passage of thinner, more elongated stools. As the tumor grows, it can constrict the colon, limiting the space available for stool to pass through comfortably. It's important to note that not all narrow or thin stools are a sign of cancer. Specific area of your abdomen, which could indicate the location of a tumor or other issue within the colon. If you're dealing with consistent abdominal, however, if you notice a persistent, unexplained change in the width or shape of your stools, it's a good idea to bring it up with your healthcare provider. Paying attention to any significant alterations in your bowel habits, including the appearance of your stool, can help identify potential issues early on. Don't hesitate to discuss any changes, no matter how minor they may seem, as they could provide valuable clues about your colon health. Number 9. Lesser Trelat sign. Lesser Trelat sign is a rare but significant skin manifestation associated with several internal malignancies, including colon cancer. It's characterized by the sudden appearance or rapid worsening of multiple seborrheic keratoses, benign, wart-like growths, often accompanied by inflammation and changes in their texture. These skin changes can be quite dramatic, developing quickly over a short period. They're typically described as intensely itchy, scaling, or even bleeding. While seborrheic keratoses themselves are common and harmless, their sudden, widespread, and inflammatory onset warrants immediate medical attention. The presence of lesser Trelat sign necessitates a thorough medical evaluation to rule out underlying cancers, such as colon cancer, given its association with internal malignancy. If you experience such a sudden and significant change in your skin, prompt consultation with a dermatologist or your primary care physician is crucial. Number 10. Malignant acanthosis nigricans. Malignant acanthosis nigricans is a rare but serious skin condition strongly linked to certain cancers, including colon cancer. Unlike benign acanthosis nigricans, which is often associated with obesity or insulin resistance, the malignant form develops rapidly and dramatically. It presents as dark, velvety, thickened skin patches, often resembling dirty skin. These patches are typically found in body folds, such as the armpits, groin, and neck, but can also appear on other areas. The color can range from dark brown to black, and the texture feels rough and hyperpigmented. The rapid onset and intensely dark pigmentation differentiate it from the benign form. The appearance of malignant acanthosis nigricans requires immediate medical attention for thorough investigation, including cancer screenings, as it serves as a potentially life-saving warning sign. Prompt diagnosis and treatment of the underlying cancer are crucial. Number 11. Hypertrichosis lanuginosa acquisita. Hypertrichosis lanuginosa acquisita, HLA, is a rare and concerning symptom often associated with advanced internal malignancies, including colon cancer. It manifests as the sudden growth of fine, downy, unpigmented hair all over the body. This contrasts sharply with normal hair growth patterns and existing hair texture. The new hair is typically soft, light in color, and covers large areas of skin, creating a fuzziness. This abnormal hair growth isn't merely an increase in existing hair, rather, it's a distinct change in hair type and distribution. The development of HLA is a significant warning sign, as it often indicates a serious underlying condition requiring immediate medical attention. The connection between HLA and cancer is not fully understood, but its appearance warrants thorough investigation to rule out advanced malignancies. If you experience this unusual and widespread hair growth, seek medical advice without delay. Risk factors for colon cancer. Colon cancer, a leading cause of cancer-related deaths, is a complex disease influenced by a multitude of factors. While early detection and treatment significantly improve outcomes, understanding the risk factors can empower individuals to make informed choices to reduce their chances of developing this serious condition. Let's explore some key risk factors. Number 1. Age, the unwavering factor. Age is a significant, unavoidable risk factor. The vast majority of colon cancer cases occur in individuals over 50. However, it's crucial to emphasize that colon cancer can, and does, affect younger adults. While less common, younger onset colon cancer often presents with more aggressive characteristics, highlighting the need for awareness across all age groups. Regular screenings should be discussed with your doctor, even if you're under 50, especially if you have family history or other risk factors. Number 2. Race, a disparity in risk. African Americans experience a disproportionately higher incidence rate and mortality rate from colon cancer compared to other racial groups. This disparity underscores the need for targeted outreach, improved access to healthcare, and increased awareness within the African American community about preventative measures and early detection. While research continues to explore the underlying reasons behind these racial differences, factors like socioeconomic disparities, genetic predispositions, and environmental influences are likely contributors. Number 3. Family history, the genetic influence. A strong family history of colon cancer significantly elevates risk. Having a first-degree relative, parent, sibling, or child diagnosed with colon cancer, particularly at a younger age, dramatically increases your chances. This highlights the role of inherited genetic mutations that can predispose individuals to the disease. Genetic testing may be recommended for individuals with a strong family history to identify specific gene mutations and tailor screening strategies accordingly. Number 4. Intestinal conditions, chronic inflammation. Individuals with inflammatory bowel disease, IBD, including ulcerative colitis and Crohn's disease, face a substantially increased risk of developing colon cancer. The chronic inflammation associated with IBD damages the lining of the colon, creating an environment conducive to cancerous cell growth. Regular colonoscopies are crucial for individuals with IBD to monitor for precancerous polyps and detect cancer early. Number 5. Diet, the power of nutrition. Diet plays a crucial role in colon cancer risk. A diet high in processed meats, red meat, and sugary foods has been consistently linked to increased risk. Conversely, diets rich in fruits, vegetables, and fiber are associated with a lower risk. The high fiber content in plant-based foods helps regulate bowel movements, preventing the buildup of harmful substances in the colon. Choosing a balanced, predominantly plant-based diet is an important preventative step. Number 6. Activity level, movement matters. A sedentary lifestyle contributes to a higher risk of colon cancer. Regular physical activity helps maintain a healthy weight, improves insulin sensitivity, and reduces inflammation, all of which can decrease the risk. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity activity per week. Even small increases in daily movement can make a difference. Number 7. Diabetes, a concerning connection. Diabetes is significantly associated with an elevated risk of colon cancer. The chronic high blood sugar levels characteristic of diabetes can create an environment that promotes inflammation and cell growth, increasing susceptibility to cancer development. Managing blood sugar levels through diet, exercise, and medication is essential for reducing this increased risk. Number 8. Smoking and alcohol, synergistic risks. Smoking and excessive alcohol consumption independently increase the risk of various cancers, including colon cancer. Smoking damages DNA, leading to cellular mutations, while excessive alcohol intake can cause inflammation in the digestive system. Quitting smoking and limiting alcohol consumption are crucial steps in reducing overall cancer risk. Number 9. Obesity, a complex risk factor. Obesity is a well-established risk factor for many cancers, including colon cancer. Excess body fat promotes chronic inflammation, hormonal imbalances, and insulin resistance, all contributing to the increased risk. Maintaining a healthy weight through diet and exercise is crucial for overall health and cancer prevention. Understanding these risk factors allows for personalized prevention strategies. Regular screenings, coupled with a healthy lifestyle, are essential for early detection and the prevention of colon cancer. Always consult with your doctor to discuss your individual risk profile and develop a personalized plan. Diagnostic methods. Early detection is crucial for successful colon cancer treatment. Several methods help identify polyps, tumors, and abnormalities within the colon. Let's explore the most common, colonoscopy. This gold standard procedure uses a flexible, lighted tube, colonoscope, inserted into the rectum to visualize the entire colon's lining. Polyps can be directly removed, and biopsies taken for analysis. While requiring bowel preparation, its thoroughness makes it highly effective in preventing colon cancer by identifying and addressing precancerous lesions. Stool tests. These non-invasive tests analyze a stool sample for hidden blood, a potential sign of polyps or cancerous tissue. Fecal immunochemical tests, FIT, are preferred for their accuracy. A positive result necessitates further investigation via colonoscopy. Stool tests are valuable screening tools for identifying individuals who require more in-depth examination. Flexible sigmoidoscopy. This less invasive procedure examines the lower portion of the colon, sigmoid colon, and rectum using a shorter, flexible tube. It's less comprehensive than a colonoscopy but can still detect many precancerous growths and tumors in this critical area. It's a useful screening tool, especially for those at lower risk. Biopsies are possible if necessary. CT colonography, virtual colonoscopy. This non-invasive imaging technique uses a CT scanner to create detailed images of the colon. While not allowing direct polyp removal, it effectively detects polyps and tumors, similar to a traditional colonoscopy, though bowel preparation is still needed. Abnormalities detected usually necessitate a follow-up colonoscopy for tissue sampling and potential polyp removal. The best diagnostic method depends on individual risk factors, age, and preferences. Consult your doctor to determine the most suitable screening option for your specific situation. Regular screenings and prompt medical attention significantly improve outcomes in colon cancer. Prevention and early detection. Regular colon cancer screenings are vital for early detection and improved outcomes. Starting at age 45 or earlier if you have a family history or other risk factors, schedule regular colonoscopies as recommended by your doctor. Lifestyle changes significantly impact risk. Maintain healthy weight through a balanced diet rich in fruits, vegetables, and fiber, while limiting processed meats and sugary foods. Regular physical activity, at least 150 minutes of moderate intensity exercise weekly, is also crucial. These proactive steps, combined with screenings, are your best defense against colon cancer. It's crucial to remember that the symptoms discussed can also stem from non-cancerous conditions. Many gastrointestinal issues, such as infections, irritable bowel syndrome, hemorrhoids, diverticulitis, and other benign polyps, can mimic colon cancer symptoms. Therefore, while these symptoms warrant medical attention, they don't automatically indicate cancer. A thorough medical evaluation, including a physical examination and relevant diagnostic tests, is essential to determine the underlying cause and provide appropriate treatment. Don't self-diagnose. Consult a healthcare professional for accurate assessment. Don't ignore potential warning signs. If you experience any of the symptoms discussed, schedule an appointment with your doctor or gastroenterologist immediately. Early detection is key to successful treatment. Take control of your health, stay informed and proactive about colon cancer prevention and detection. Regular screenings and a healthy lifestyle are your best allies. Like this video if you found it helpful, subscribe for more health information, and hit the notification bell to stay updated on future content. Let's work together towards better health and wellness.